Buenos días. Thank you. Un placer. It is an honor and a pleasure to be here with all of you. I am so enthused to be speaking to your Excelencia conference, last year virtual, and now the opportunity to really network and to meet each other. I would encourage each and every one of you, make sure that you meet and you talk to at least one new person. This is what being here at UCI is all about, is that networking, is meeting the people who are really wanting to help support you and lead you in the future that you want to create. And you know what? You never know. The person that you may be introducing yourself to may be your new coworker in that new position that you were looking for. So I am privileged and honored to be here as the California Surgeon General. This really speaks to the diversity, the recognition that we need voices at all levels of government, and in particular as Surgeon General, to represent the more than 40% of the population here in California. Because we here in California, as Latinos, represent 40% of the population. So just stop to think. By 2030, we are estimated to be 1 in 2. That is powerful. So what is the power of each one of you? Each one of you here is a leader. Is a leader because, one, you're here in school and you know what the future is going to be holding. So whether you realize it or not, your leadership is, just because you're here and just because you're Latino, is a testament to the rest of California. So please take advantage of that. I've been asked to share how did my MBA degree impact my position now as Surgeon General. Lots and lots of opportunities and lots of great insight. But it really boils down to 3 things. One is education, because education was really critical here. The other is digitally driven, right? Little did we know how insightful, how ahead of our times we were here at UCI with that digitally driven. And the other is really being able to innovate, as Dean Williams had brought up. So let me start first with education. Education is so critically important. And I can tell you, as the daughter of a single mom, only child, my mom would work up to 3 jobs as a key punch operator. So this is really before, computers were just starting. She would also be a waitress, and she would also sell household items. I don't know how many of your moms sold Tupperware, but my mom sold Tupperware, and that's how we had a new car, because she would sell so much, and they would give her the car for the year, and so she had to sell a lot more so that she can get a new car. But she would work really hard, and so it was that hard work to help provide the education, to help provide the opportunities that she never had, that really inspired me to be the first one in my family to go to college. And I say family because, as you know, all of our Latino family is not just your mother and your father and who's in your household. Family is the primos and the tias, right? It's everybody. So my aunt, who came from Mexico, and my grandmother was my aunt's sister, had 13 brothers and sisters. So we had all of my cousins, all my primos. That was my family. So I was the first one in my family to go to college. And since then, many of my cousins have been going to college. But this is so critically important, because if we stop to look at the data, it's estimated that 1 in 3 students in the United States will be Latino by 2030. 1 in 3. Stop to think. Now, how many of those students, though, are actually going to graduate from high school? We can happily say that here in California, the graduation rate has improved. We are now at about 82% graduation rate for Latino. But we still have The lowest graduation rate when you compare us to the rest of the population. When you compare us to the African American, when you compare us to the Asians, when you compare us to the white, we still have the lowest graduation rate. So what does that mean for us? You are all here. You all recognize the value of an education. Please, please reach out to somebody in your community. Make sure that you're the mentor, even if it's to your neighbor, to your cousin, to encourage them graduate from high school. But more importantly, if you can, encourage them to go to college, right? That is so critically important. Because if we stop to think, so as an OBGYN, I can tell you when I was working in LA County, 1 in 2 babies was to a Latina mom. In California, we're getting close to that 1 in 2 babies. So what does that mean for the future? What does that mean? Think about it. What does that mean for the workforce? What does that mean for voting? What does that mean for policy? We are a powerhouse, but a powerhouse that hasn't really taken advantage of the education and the opportunity. So education, we know, is a social determinant of health. So now the public health piece is coming in. How many of you are familiar with social determinant of health? Okay. So social determinant of health is a term that we use to describe what happens outside of, what impacts your health. Social determinant of health. Many people think, wow, you know, their health is not so good because they don't go to the doctor. But did you know that only 20% of your health is impacted by that doctor's office visit? 80% of your health is as a result of what is happening in your environment. Your job, your education, your genetics, all of these issues, the environment that you live in. Do you have access to a healthy diet? Do you have access to a place that you can feel safe and walk? All of these things are impactful in determining your health. So social determinant of health, one of those is education. We know that the more educated you are, the better your health will be. And you can actually predict that if we look at our zip code, right? When you're better educated, you're going to live in a zip code that has more resources. And that means that you're going to have access to health care, you're going to have access to better food, you're going to have access to an environment that you feel comfortable walking in. So all of these things are really impactful. So education is so critically important. My mom would tell me, Mija, when I die, I'm not going to leave you with anything of value. The most valuable thing I'm going to leave you with is your education, because nobody is going to be able to take that away from you. Your education is the gift that if you really invest in yourself is going to pay off the most. And I know, coming from the background that I came from, that sometimes it costs money, right? And sometimes to know that, wow, my tuition is actually more than my mom makes, that's pretty scary, right? And that's okay. It is scary, but it's scary because we're not familiar with those numbers yet, okay? Because my hope is that you'll realize that education is the best investment that you could ever make in yourself. We're seeing what's happening with the stock market, right? We're in a business school and we can predict. We see what's happening with real estate, right? We see what's happening, scary to say, with the economy. But what is it that is 100% predictable in terms of investment? That's you. Because you are the one that's going to determine how well that investment is going to pay off. So remember, education is a critically important piece. So I hope I've made that impact, and thank you all for being in school. Stay in school. And I'm happy to report that here at UCI, 1 in 4 graduates are Latino, and that is fantastic. But we have to improve those numbers if we're looking at the big trajectory of who we are going to be in the future, not only in California, but in the United States. We have to be that leadership. Now, the second part that I learned from here at the Palmarage MBA school was digitally driven. Who could have predicted the world that we were going to be catapulted into from COVID, right? We were going to be made to go into this world virtually and in our homes and in environments that we had no control over sometimes, right? And so I can tell you, when I started my MBA program, it was in person, and it was great because we got to meet people, and you comadrear, and you talk to people. It was fantastic. But then COVID happened, right? I did not realize when we were in our MBA program that we were being prepared. Sometimes things happen for a reason, you know what they say? So when we were in our MBA program, there was one instance when we had a marketing presentation we had to do. And everything is team-based, right? Your grade is based on the team. And so one of our team members was not going to be able to be there in person because they had family issues. The rest of the team was worried. This is before COVID, was worried. And we thought, oh my goodness, we're not going to get a good grade because this team member is not going to be there. Well, we made it happen. We used Zoom. It was so novel, right? It was so novel to be able to bring somebody into the presentation, and they were able to present virtually via Zoom. We did well. So it was that innovation, that early adoption, being able to be comfortable in a digital world that has really made a difference. Now, I can honestly say we've impacted and we've propelled all of that experience even more. Personally, I am on international Zoom presentations with the India OBGYN Society, sharing best practices on how to reduce perinatal negative outcomes with over 2,000 people worldwide. Who could have ever thought about that, right? There are so many other meetings that we can expand our reach and our influence simply because of this digital world. And so this is even improved in healthcare. We now know that previously, before the pandemic, about 5%, 8% of all doctor's visits were virtual. And now, depending upon the health system that you are, about 95% of the visits can be virtual. Increasing the access, increasing, hopefully, the quality of the healthcare to many of those who don't have access to health. So, really, really important. But unfortunately, Latinos have not always been so benefited from the digital advances, right? Because we know there is a digital divide. We know that nationally, about 1 in 3 Latinos have a difficulty in accessing broadband and accessing the internet. We know that about 1 in 2 Latinos the parents have difficulty getting enough computers, enough iPads for their kids to be able to do the schoolwork that they need. So there is a digital divide. So even though we've made great advances, the digital divide is still there. But we're working on it, and I can happily report that here in California last year, Governor Newsom signed a bill that allocated $6 billion to create the infrastructure for broadband access. And this is important because it's going to be free. It's going to be accessible to the most underserved communities. That's going to make internet available to the underserved communities and businesses. So this is going to help build and bridge that digital divide. We now see that many more public schools are providing the computers, right, that our kids need to be able to complete their homework. So this digital divide is slowly closing. And finally, innovation. Dean Williams highlighted innovation is critical, and I'm always one to really think outside the box. I can honestly tell you, I've implemented and used so many of the Harvard Business Review cases. You know, how many of you enjoy those long HBR cases? But they were so critical in helping me adopt some of the organizational problem-solving skills at my state level job. And more importantly, I love the design thinking, right? Do you remember design thinking classes? Yes. So in public health, they call that human-centered design. So how are we going to be investing the money that we want to improve the healthcare of California in the way that the community needs it? And that is what is happening right now. Using that design thinking, using those focus groups, using the information from the Latino population in the various sectors, whether it's a Central Valley, Northern California, Southern California, down Imperial County, where we are the majority. How are we going to provide the care that we need? So that innovative thinking is really critical. My office is going to be committed to focusing on 2 areas: mental health and reproductive health. Mental health, because 1 in 5 people in the United States already suffer from some type of mental health. Unfortunately, like many of the health outcomes that already are present, people of color are the ones that are disproportionately more impacted by negative outcomes. 20% more of Black and African American people suffer more from depression. 35%, this is nationally, of Hispanics get access to the mental health that they need when there is a diagnosis, compared to about 46% of the white population. So it's not enough that we have a diagnosis. We need to have that extra help that is needed. So mental health is critically important. And I'm happy to share that the governor has allotted over $4.7 billion in investments for children, youth, and behavioral health. And this covers children from 0 to 26. When I heard 26, I'm like, wait a minute, that means college age students, right? That means some of you in here. And so that's going to be my push, is to come up with innovative ways that we can help our high school and college age students, because we know that when you are in your high school and college, early college years, that's when you're going to be manifesting maybe the mental health disorders because of the stress, anxiety of being in a new environment, of being maybe in a situation that you were not familiar with. I mean, Orange County, Irvine is very different maybe from South Central LA, where I came from. I was always a little weary coming over, like, who are the people that are around me? But slowly it's starting to change. So you get that stress and anxiety. And what happens? You start to self-medicate. Maybe I'll drink a little bit more. Hey, somebody's giving me cigarettes. Somebody's giving me something to drink, drugs. So my hope is to break that cycle and really help all here so that we can actually improve the mental health of all. The other, in terms of reproductive health, is what I have done as an OBGYN, and basically focusing on 2 areas. Making folks aware of the reproductive rights that California continues to provide, not only to us here, but provide as an example to the rest of the nation. We are leading the way for what healthcare in reproductive health is going to look like. And it's not just abortion. It is preparing for that pregnancy if you want to have it, having good perinatal outcomes, decreasing maternal mortality, because even though California has the lowest rate of maternal mortality in the country, we still have work to do. African American populations have 3 to 4 times increased maternal mortality rate than the rest of the population. So we have work to do. So my office is committed to doing that. We're going to be focusing on what has already been started, which is ACEs, the adverse childhood events. And the adverse childhood events are experiences that we have as children, whether it is neglect, abuse, incarceration by one of our parents, or divorce. All of these things impact our health. But if we address these early on, and this is from 0 to 18, that's what's been, the evidence has shown, we can actually break the cycle of depression, by 44%, decrease homelessness, improve graduation rate, decrease substance abuse. So all of that work has been started, and we're going to continue doing it. So with that, I want to remind you that equity is critically important in everything we do at the state and here. And I am so pleased to be here, to be the voice of the Latino population, because we know that sometimes we have to say things in Spanish and say things that are difficult and not acceptable in our culture, because we know depression, you can't say depression, you can say, yeah, mi tía está nerviosa, right? And my mom would always say that, yeah, deja tu tía, she's nervous. Yeah. So, but so that's the beauty, is that we know the words, we know the language, we know the way to communicate with our culture. And you have to realize that you are the leaders for California, because California will be, as well as the rest of the country, predominantly Latino. And as Dr. Hayes Bautista at UCLA oftentimes says, if you're not Latino, you're going to be related to a Latino. So, yeah. So with that, I thank you so much for the opportunity to be here with you. Please see me as a resource, as a voice for all of you, and I'm looking forward to partnering with all of you. Thank you.